Welcome, Head Start and Early Head Start advocates. My name is Tommy Sheridan, and I'm the Deputy Director at the National Head Start Association. I'm so glad that you joined us today for our training on advocacy efforts around our Early Head Start Rising campaign. As you know, Head Start and Early Head Start play such an incredible role in the lives of young children and their families. And we are so thrilled at National Head Start Association to look to expand our efforts beyond just what people think of when they think of Head Start. It's not just the 3- and 4-year-old Head Start program that makes such a difference, but we know it's that brain development stages from pregnancy to age 3 and all the way up into when kids go into school that makes such an important difference. And also, as you know, early Head Start, while so critical, and all of the research continues to show it, remains really the most insufficiently funded part of the Head Start system, as we currently are only able to serve about 11% of eligible infants, toddlers, and their families. And so now is the time to increase funding and to expand access to early Head Start, really to level the playing field. That's why we've created a data-backed communications toolkit as part of our Early Head Start Rising campaign, which is an ongoing initiative to address the urgent need to care for and support pregnant families, infants, toddlers, and all their caregivers through a major expansion of Early Head Start. We hope this toolkit helps you communicate directly with policymakers and policy influencers, along with the resources you need to help you grow new champions. And so thank you for joining us, and let's dive right in. As you know, NHSA has a vision and a mission, like many of your organizations do too. And NHSA's vision really is not just the vision for us, but it's our vision for you. It's our vision for what the work that you do every single day as a member of the Early Head Start and Head Start community. And that vision really is to lead and to advocate, to be that untiring voice that will not be quiet until every vulnerable child is served with the Head Start model of support for the whole child, the family, and the community, and then effectively advocating to make that happen, working diligently for policy changes to ensure that all vulnerable children and their families have what they need to succeed. From that mission, or from that vision, NHSA has a mission to really support you in all of those efforts. It is to coalesce, inspire, and support the Head Start field as a leader in early childhood development and education. And we really are compelled to fulfill this mission by the promise of a series of outcomes. First of all is a united and powerful Head Start voice. That is something that when we are all saying the same thing, whether you are in Manhattan, New York City, or you are in Manhattan, Kansas, or you are in the Head Start program in the bottom of the Grand Canyon, which there is a Head Start program in the bottom of the Grand Canyon, it's an American Indian Alaska Native program. And if we are saying the same thing to our elected leaders, we can move mountains. We've done it before, and I think we'll do it again. Actually, I know we're going to do it again. The second is a collegial collaborative Head Start field, one that supports everyone because we know that no matter where you are in the country, that your children and your families and your communities deserve the Head Start model of support for the whole child, the family, and the community. Connected to that is a nonpartisan support for an increased federal commitment to Head Start. We know this is not easy these days. It always seems like if something that Republicans support, Democrats oppose, and if Democrats support it, Republicans oppose. But let's be real, Early Head Start and Head Start are things that anybody, any human should support because it is about our children, it is about our families, and it is about the most at-risk children and families as well. And we fundamentally believe that Democrats and Republicans alike should and will support the work that we do, and we need all of them in order to be effective at the work that we are going to do. And that is precisely why we have established this and other types of trainings to help us communicate effectively, no matter the partisan background, no matter the approach that individuals may take. And at the end of the day, if we are able to do all of this, that will lead to healthier, empowered children and families and stronger, more vibrant communities. So thank you once again for joining us, and I'll flip it over to our colleagues over at Forthright Advising to take us into the training.
Hello, my name is Emily Swartzlander, and I am the Vice President at Forthright Advising. I'm here today with my colleague, Lauren Empson, a Senior Advisor at Forthright Advising, and we are delighted to be walking you through this training today. Forthright Advising is an all-remote PR firm that works exclusively with organizations that love kids. That means we work with nonprofits and public school districts that support children and their families. As Tommy mentioned earlier, we are here today to talk about the Early Head Start Rising campaign, which is a campaign to address the urgent need to care for and support pregnant families, infants, and toddlers through a major expansion of Early Head Start. As you know, Early Head Start is able to reach just 11% of eligible infants and toddlers, and there are approximately 4 times fewer Early Head Start slots than Head Start slots, which prevents the most vulnerable learners from experiencing a continuum of quality care during that critical prenatal to 5 period. There's also, of course, an increased need in light of the pandemic, but the need was already great before the pandemic. So it's past time to ensure that every eligible family can access the support they need to give their child a head start during the most critical period for brain development, prenatal through age 3. So we've got 2 objectives with our training today. First, we're going to build understanding for you of the Early Head Start Rising advocacy call to action, along with the messages and the themes that the data shows us will resonate with policymakers, policy influencers, and other stakeholders. And then we're going to provide you with and walk you through the tools and resources that we have created that will help you to advocate for increased funding at the federal and state level and expand early Head Start access. So there are 2 parts to the training on our agenda today. In part 1, we'll walk you through the call to action, the research, and the themes and messages that resonate with policymakers and policy influencers. If you'd like to take those themes and messages and go out and advocate, that's great. You can pause after part 1. If you want to join us for part 2, we will walk you through the tools and resources that are part of the Early Head Start Rising Toolkit that you can then use to advocate and build support. So again, this is part 1 of the training, where we'll walk you through a call to action and themes and messages that resonate, particularly with policy influencers and policymakers. To create successful core messaging and a successful campaign, we must first understand the current landscape, know what our opportunities are to change the landscape, and understand our target audiences that we need to reach to make change happen. For our research phase, we scanned and synthesized NHSA internal and external materials, research from the Pritzker Children's Initiative National Collaborative for Infants and Toddlers, and research and materials from partner organizations such as 0 to 3, the First 5 Years Fund, and the Foundation for Child Development. We also looked at research and advocacy materials from organizations such as the Pew Charitable Trusts, the Centers for Disease Control, the Commonwealth Fund, and others. We used this data to conduct a landscape analysis for pregnant women, young children, and families, with a focus on families and children from low-income households. We conducted a landscape analysis for Early Head Start and an opportunity analysis for changing the landscape for Early Head Start and for families and young children. And then we looked for keywords and messages that resonate with all of our stakeholders, policymakers, policy influencers, Head Start members and parents, especially parents from low-income households, and determine some top-level best practices for reaching out to all of our audiences. Here are some key findings from our landscape. You will know these because you work on the ground every day. Millions of infants and babies live in poverty, and COVID has exacerbated that. There is an historic, systemic lack of family-based support that has kept parents, especially mothers, out of the workforce. Early Head Start helps families navigate critical services, in particular to populations that have historically had inequitable access. And as we mentioned, need is much greater than capacity. The good news is we have several opportunities to change the landscape. We know that advocates are already in place to amplify NHSA's message. We know that voters on both sides of the aisle, as well as independent voters, largely support policies that work to help women, children, and families. We know that investing in young children and families is an investment in the future workforce, something that the business community in particular is very interested in. We know that investments that lift children out of poverty have enormous long-term benefits. And we know that investing in and expanding Head Start is an investment in the highest quality of services and supports for families and young children. But it all starts with funding. And that's why our federal call to action is to permanently expand the number of early Head Start spaces funded on an annual basis by 500,000, and to make sure that all income eligible children prenatal to 5 can access early Head Start and Head Start services. And at the state level, this means allocating recovery funding to expand early Head Start and create or improve facilities, along with encouraging partnerships with childcare programs to reach more children. So as I mentioned, we've got several target audiences for the toolkit: policymakers and policy influencers, business leaders, parents and families, and partner organizations. For the purposes of this training, we're going to focus in on policymakers and policy influencers because we know that those are the people that we need to reach and have messages that resonate for in order to reach our call to action to increase funding and expand early Head Start. So based on all of our research, we know that these are the key themes that resonate with policymakers and policy influencers: brain development, and really leaning in on the fact that this is a critical window for brain development for young children. Messages that support maternal and child mental and physical health, also very important to policymakers and policy influencers. Giving all children a strong start in life and bringing equity into one of the arguments for prenatal to 3 policies and programs. We know that the idea that kids are essential is important to policymakers and policy influencers, and that this is the time where they only get one chance for a strong start during this critical period of development. We've also learned through our research, and in particular the research from the Pritzker National Collaborative for Infants and Toddlers, that there's a secret sauce for messaging that really works well with policymakers and policy influencers. And that's to take messages about children, kids are essential, and add a sense of urgency. They only have one chance for a healthy start. And that together creates the most effective message combination. Creating a sense of urgency around maternal health is also highly effective. And then as supporting messages, adding in equity, adding in infants and toddlers being our highest priority, are good supporting messages to this secret sauce. Using all of our research, we pulled together core messages for this campaign. And I just want to quickly walk you through the components of the core messaging at a top level, and then we'll dig into that, what that looks like for policymakers and policy influencers. There are 5 elements to our core messaging. First, we talk about the need. Why do we need to expand early Head Start? What is the need right now? We talk about how this gets done. What are the mechanisms and the levers that we need to pull to expand early Head Start? In this case, funding being the primary lever. Why invest in early Head Start? What are the success metrics that we can show for early Head Start, and why this particular initiative is so important? And then an overview and a vision, which really pull everything together and are our guiding post. And together we use these core messages as a foundation for all other messages, talking points, communications materials, and elements that we're sharing out to our target audiences, so that we're all speaking from one unified message. And those audiences are hearing that message over and over again and can therefore internalize, understand, and act on it. I'm going to walk you through the core message components for policymakers and policy influencers. I'm not going to read it word for word, but I am going to pull out the key words and phrases that you see reflected from the research and from that secret sauce that we know works. If you'd like access to the exact language, you'll find it in the toolkit, along with talking points and materials for all of our core audiences. For our overview, you'll see things like now is the time to invest in our nation's greatest resource during the most critical years of a child's development, prenatal to age 3, so that we can build a strong foundation for a brighter future. With need, We know that our youngest children's brains are rapidly developing and they only get one chance at a Head Start. That's why we're working especially with income eligible families to provide wraparound support and ensure that our country's economic and family structures are supported and in place. Why increase funding for Early Head Start? Because it works. Early Head Start works with diverse communities, builds a strong foundation for infants, toddlers, and their families, allows families to see themselves, their cultures, and their backgrounds through the services, fosters cross-sector collaborations, creates a bridge to Head Start and to kindergarten, and breaks generational cycles of poverty. How does it get done? Well, we've got to ensure that all families have access to that crucial support. But right now, only 1 in 10 income eligible infants and families do. So funding is the first step. We also want to point out that it's a good investment too, because we know that that's something that resonates with policymakers and policy influencers. And so in the vision, you see how this is pulled all together. Our research and our other core messages all comes together right here. That we are supporting children during the most critical years of their children's development. That's bringing in that sense of urgency. That's bringing in a brain development message. When all families are able to build a strong foundation, that's bringing in equity. That's speaking to our economy. And when we talk about a brighter, healthier future, that is also bringing in those health messages, those equity messages, those economic messages, everything that we know works to speak to policymakers and policy influencers. So that concludes part 1 of our training. I'm going to kick it over to Lauren to talk about part 2 and really walk us through all of the resources and tools that we've built to help you advocate at a federal and state level. Again, all of the messaging that we just walked through is available to you in the Advocacy Toolkit, and there will be a link for how to access that at the end of this presentation.
Thank you so much, Emily, and hello to everyone. As Emily mentioned, my name is Lauren Empson. I'm also part of the Forthright advising team over here. And Emily did a great job of leading us through part 1 of our training, giving us a really amazing sense of what we want to say in order to influence decision makers and help them understand all of those amazing benefits of early Head Start. Now we're going to be spending a little bit of part 2 in learning how we can get them to actually hear that message and reiterate that message again and again, so that way it is not only getting out there, but that it's really making an impact. So we have gone ahead and created a toolkit with key resources to help you get these messages in front of those who can effectively make change. With this toolkit, you'll learn how to tell your story, meet audiences where they are, and build a common goal. But it's more than just reiterating the messages that we know resonate with decision makers. It's about making these messages relatable. So it's about storytelling at the end of the day. When you are able to weave a story into your messaging and advocacy efforts, you are actually helping your case. You're making your points more easily understood. Your story can really be compelling and pull at people's heartstrings. And it's also more persuasive, helping them buy into what you really want them to do at the end of the day. So as we saw in part 1, talking points or messages, they speak directly to your audience, and they're an essential part of advocacy. This is really the what you want to say to help make your case, and really tying it to specific interests and the goals of your audience. So that's why we've created a series of audience-based talking points, again, or messages that you can use as the foundation for your advocacy communications. This is really your bread and butter and can be incorporated into everything else that we're going to be talking about throughout part 2. So in addition to the talking points that you'll have for conversations and correspondence with policymakers and policy influencers, you will also have at your disposal talking points that are specifically catered to business leaders, parents and families, and national nonprofits and partner organizations. So true, while policymakers are the ones who are actually going to be making the change, putting pen to paper to change policies that will influence early Head Start programming, these other audiences are very important as well too. They not only have the power to make change in your local communities, but they are the ones who can really help bolster and advocate on your behalf. So speaking to these audiences is just as important as speaking to the policymakers and influencers themselves. So when you are talking to them, it's really important to recognize that there are some nuances in their goals, in their interests, and how you can really have an effective conversation with them. So for example, Emily let us know that brain development is a very important area for policymakers and policy influencers. When you're able to tie brain development into your conversations with that audience, it can really help elevate your platform. But brain development, interestingly enough, is also really important to parents and families, but the context is a little different. Parents and families really are curious about brain development in the context of their own child's social and emotional development. They want to know, what should my toddler or young child really be able to do at this stage of life? What should I expect from them? So being able to recognize these types of differences in your audience and the talking points that you should be using with each audience really helps you build a strong case for early Head Start. So we've also, in the toolkit, you will find a facts and figures one-pager. We know very well, as I'm sure you all do, that people's attention is very much divided nowadays between different platforms, messages, messengers, and even more. Making your case can be a daunting task, and it's really important to be able to cut through the clutter. So that's why we revised the original Early Head Start Facts and Figures one-pager to help you easily and quickly make the case for investing in early Head Start. In this one-pager, you'll find a summary of the call to action that Emily previously outlined for us in part 1, some quick takes on the services and support provided by Early Head Start, and an outline of the impact that these supports have on their communities. It's really just a down and dirty, quick hits that help you make your case. Frequently asked questions are another resource that you will find in your toolkit, and these are an incredibly effective tool to help your audience find the answers to the questions that they have. We looked at common questions that decision makers across all audiences might have about early Head Start, and then compiled a list of responses that you can incorporate into your own outreach. These questions include everything from what is early Head Start to what types of support does early Head Start provide, how does early Head Start differ from the National Head Start program, and a bunch more. So we recommend using these FAQs. You can either print them and share them directly. You can post them on your website. You can use them in your conversations, or you can even separate out individual questions to be their own social media posts. So a lot of different ways that you can share this information. So as we previously mentioned, storytelling is an incredibly effective way to get your audiences bought into your case. People remember stories more, and then it helps them better relate to your cause. So in your toolkit, you will find step-by-step instructions on how to create your own case study and tell your story. You'll also find an example of a case study to help you really think through on the type of story that you might like to tell. And then once you've got your case study developed, you can send that along with a letter. Again, break out pieces of the case study for social media, and really you can use it in so many different ways. But there are a few best practices to keep in mind when you're creating your case study. And all of these are in the toolkit, but I'll just go over a few right here. You really want to make sure that you're aiming for diversity in your case study. Readers are more likely to empathize and act when they identify with someone. So the more you're able to help your end reader see themselves in your case study, the better off your case study will resonate. You want to include images. Fun fact is that 90% of information processed by the brain is actually visual. So including images can really help people grab onto your case study and what you're trying to say. Incorporating direct quotes is always really helpful from your main storytellers. These reinforce your story and the main points you want to leave readers with. And then you really want to consider the impact that a story will have on the storyteller's life. When you're using stories, make sure you're using them as a tool for empowerment. You want to show your impact, but position your organization as a partner rather than a savior. And then aim for about a 7-minute read or less, which equals about 1,600 words. And this is for maximum reader attention. And as much as decision makers look at their inboxes and voicemails for information and communications, social media is a platform that we just cannot ignore nowadays. For a little context, 75% of parents and caregivers log on to Facebook every day, many of them logging on multiple times a day. And of all the social media platforms, policymakers use Twitter the most. What this tells us, though, is that not all platforms are created equal. So we need to ensure that, like all of the efforts that we're talking about here today, we're using these platforms smartly to reach our audiences. So again, my favorite, a few best practices. Again, all of these will be in the toolkit, but just to go over and talk a little bit about them today. Like all of these, social media, we really need to understand our audiences and messengers. We want to recognize who we're trying to reach with what message and who is best positioned to deliver that message. So for example, an anecdote from a family can really help build an understanding of Early Head Start's impact. And that could resonate with a variety of the different audiences that we're talking about. However, a business leader who might be wanting to invest not only their time, but their money in Early Head Start, they would probably want a little bit of additional information about how the program works on the ground so they can better understand that potential financial impact on their community. So really understanding those different audiences, what their interests are, can help you better craft a social media post to reach them and really resonate and have them take engagement on. Similarly to our case studies and other materials, including an image or a video is incredibly helpful. That is especially true for social media. A really interesting study that we found showed that a single image has the power to sway people and change behavior. This is unlike words alone. So including that image or video really helps you not only make your case and get people bought into your cause, but it's also just the type of media that people are more likely to engage with on social media, with 6 out of 10 people preferring online video platforms to even traditional TV. There's also a best time of day, interestingly enough, to post your content to reach different people. And posting at the optimal time and days of the week can increase the likelihood that your content will actually be noticed. And these times and of days vary depending on who you are trying to reach. So for example, the best time to post for the healthcare industry on Facebook are actually 11 a.m. during the week. But the best time to post if you're trying to reach someone in the education sector on Facebook, specifically Wednesdays and Thursdays at 10 a.m. So all of those times are outlined in the toolkit as well, so you don't need to memorize them. There's also an ideal character count. So as I'm sure you could guess, shorter is always better, but there is an actual limit. Facebook and Twitter and a lot of the other social platforms will cut you off at a certain point. So just make sure that as you're drafting your social media information, that you're keeping that in mind. And of all the resources that we've talked about, from case studies, FAQs, talking points, videos, etc., they can all be shared with your networks. And this is through email and newsletters. Nonprofit newsletters are seeing higher open rates, and nearly 90% of Americans over 15 use email. So these are really great, not only a way to repurpose prior information and collateral that we've developed, but it's an incredible tool to reach the people that we're trying to reach. And again, with the best practices, as you're creating emails, you really want to make sure that they're optimized for mobile. 1 in 5 American adults right now are smartphone-only internet users. This means that they own a smartphone, but they don't actually have traditional home broadband service. So they're not necessarily able to check their email on a laptop or a desktop, but they are able to check it on their phone. So, and nearly half of emails are actually opened through mobile, as I'm sure we all can attest to. So you just want to make sure that anything that you're emailing out, either as a standalone email or within your newsletter, works just as well on a phone as it does on a desktop or laptop. Again, including an image, I've said it time and time again, but images really resonate with people regardless of what type of communication platform we're talking about. And then also you want to customize it. making specific concrete asks for your stakeholders to act upon, and then offer them several different ways to engage at different levels. This is a really great way to do additional click-throughs and things like that and really have people take action on what you're asking them to do. Let's get into op-ed placements a little bit. So opinion pieces are one of the most powerful forms of media, helping individuals and organizations advance their agendas, presence, and even their reputations. So in the toolkit, you'll find a template opinion piece that you can actually customize to showcase your personal story and the impact points, both for the families that you're working with and your community. But of course, we know that an opinion piece is only effective when it is in fact published. So to help you get your opinion piece seen and published, a few tips. You're going to want to follow the submission guidelines. Every outlet that will have their own submission guidelines posted on their website, and you can find them by either going to their website directly or by contacting an editorial page editor. Timing your op-ed can really be a helpful way of increasing the likelihood of publication. They're more likely to run if there's a newsworthy hook. So if there is an event happening in your community, you can make sure that you are tying your opinion piece and sharing your op-ed within 36 hours of that news event. Submitting it to one outlet at a time. A lot of times media outlets will have exclusive agreements. So you're really going to want to pick your top outlet that you would like to have that piece published in and start there, and then just having a plan B or a plan C if that outlet should pass. Following up is pretty much the name of the game when it comes to opinion piece publications. So once you've submitted your piece, give your first choice media outlet time to determine if they want to run your piece. Usually for a piece tied to a news event, 24 to 48 hours, but if something's a little bit more evergreen, then you can have about a week before you follow up. And then knowing when to move on. There are times, and it will happen, it's happened to all of us, even in the communications field, when a publication will pass on a piece, but that's just when you engage with your plan C or plan B outlets. The biggest thing though is that anytime someone might pass on your piece, make sure you're thanking the person that you're working with so that you're building a relationship and opening the door for the next time that you might like to submit with that particular publication. All right, let's go into email, letters, and phone calls. So today it is easier than ever to contact your policymakers. When past and present members of Congress and high-level staffers were asked whether constituent input matters, all of them emphasize that it does. They do also admit that it can be hard to change their mind on a particular policy issue, but it is crucial that they get to hear from their constituents, from you all, so that way they have additional information as they are making these really important decisions. And a personal letter or a phone call can go a really long way. So again, keep in mind that we're not only working to contact your federal representatives, but also your local state representatives. All of this contact information can actually be found at nhsa.org/take-action. Once you have their contact information, you want to make sure that you're succinctly conveying what you're advocating for, referring back to that call for action at the appropriate federal or state level. And then if you're able to incorporate a quick story, I know that that could seem like a lot, especially in a phone call or voicemail that you'll be leaving. But again, it's a really great way to make things feel more personal. Lastly, this is kind of a pro tip, request a written response. And that is a really great way to cut through the clutter and make sure that you're heard. Okay, last one, and appreciate you all hanging in there. So our additional way to engage our audiences are through meetings and site visits. So when we're talking about meetings, these are in-person and now virtual, and they're an incredibly effective, compelling way to share your stories and impact with policymakers and policy influencers. Policymakers and even their staffers and advisors, they regularly meet with their constituents to hear their take on a variety of issues and topics. Site visits are when you are actually able to invite policymakers, business leaders, and community members to see your program in action and speak with the staff and families. So you can schedule in-person or virtual meetings and site visits to help make your story heard. Okay, and our last set of best practices for you when you're scheduling meetings and site visits. First and foremost, you want to find your champion and get to know them. Who do you actually want to engage with? If it's a policymaker, again, you can go to that website, nhsa.org/take-action to find your appropriate representative. If it's a business leader, you can look at a bunch of different resources available in your community, whether that's your local newspaper or your Chamber of Commerce. They all have really great intel on who you might be able to work with to champion your cause. Then you're going to want to build that relationship. Your first communication should be an introduction and not an ask. This is really where you can share information about their program, get their buy-in, and build that relationship. Then you can go ahead and secure your meeting and schedule that site visit. Use an online calendar for members of Congress, or you can work with a scheduler. Prep is key. We love ourselves prep. You want to identify who on your end is actually going to participate, whether it's a meeting or a site visit. Prepare an agenda so that way everybody is staying on task. And then you want to know and practice your message. What are those key things that you really want to tell your champion to help them buy into your cause? And what would you ultimately like them to do with all of this information at the end of the day? Then you actually get to do your meeting. You want to stay on topic, plan a little in advance to see if you're able to take a photo, share on social media, invite any members of the press as well, and then show them around to either your program or really make those messaging points known. And then the last is to follow up with a really nice thank you for coming, thank you for having us, and again, reiterating those calls to action that you want to leave them with. And this brings us to the end of our training of part 2. So I really wanted to just take this time and thank everyone for listening and for inviting us to share this information with you. And we'll go ahead and throw things back over to Tommy to close us out.
Well, that wraps up our training. Just wanted to say one more time, thank you so very much for completing this early Head Start Rising Toolkit training. As Head Start community members and advocates for children and families, you truly make our future success and the future success of millions of children and families possible. Now, as a final step, one last thing to do for part of this training, I'd ask you to go ahead and go to nhsa.org/take-action. The link is right there on your screen, and sign up as an advocate for Head Start and Early Head Start. That way, whenever there is some sort of breaking news, policy, or advocacy action that we need to take to reach out to our members of Congress and ensure a bright future, you'll be the first ones to know. So after you sign up, last thing, just wanted to say thank you one more time, and we will make sure that Early Head Start will be strong for decades and decades to come.